Ladies and gentlemen, welcome to the one, the only, the true, the original, My Philippines Interest. I'm your host, Harry Dick. Thank you so much. You're all so kind. And once again, welcome to the one, the only, the true, the original My Philippines Interest. And we got a great show for you today. You betcha. Ladies and gentlemen, before we get started with the main topic, I'd like to talk about something that is very important and sometimes easily overlooked. When we're traveling abroad or even just traveling anywhere, we want to make sure that we are prepared. We are prepared physically, mentally, and financially. Traveling, whether it's abroad or to another state or to another city, it can be taxing physically, mentally, and financially. And most recently, in the Philippines, there was a creepy, frail old man that was wandering the streets till 3 a.m. in the morning, looking for a hospital, looking for a clinic that would accept him because he had a medical emergency from years of bad dieting and chain smoking and other things. Looking for a place that would accept him, and he couldn't find a bed because he could not financially afford the bed. So make sure that we are prepared. Alrighty then. Let's get on with the topic. Today we are talking about Frank sign. Yes, folks, Frank sign. Frank sign is an indicator of possible health problems we may have. Frank sign. Let's listen to what some of the experts have to say about Frank sign, an early indicator of possibly heart disease, stroke, dementia.
Unraveling Frank's sign. In the field of medicine, sometimes seemingly unrelated signs and symptoms can provide valuable insights into a person's overall health. One such intriguing sign is known as Frank's sign, which manifests as diagonal earlobe creases. While it may appear insignificant at first glance, this subtle physical feature has been associated with a range of health conditions, including coronary artery disease and dementia. In this video, we'll be talking about the concept of Frank's sign, explore its potential connections to various diseases, and discuss its significance in clinical practice. 1. Understanding Frank's sign. Frank's sign is named after Dr. Sanders T. Frank, who first described the association between diagonal earlobe creases and cardiovascular disease in the late 1970s. Dr. Frank observed that a significant number of patients with coronary artery disease exhibited this characteristic earlobe crease, sparking interest in its potential diagnostic value. Identifying Frank's sign. Frank's sign is characterized by a diagonal or oblique crease that extends from the tragus of the ear to the bottom of the earlobe. It is usually more prominent and deeper in individuals with coronary artery disease or other related health conditions. 2. The association with coronary artery disease. The link between Frank's sign and coronary artery disease. Numerous epidemiological studies have established a significant association between Frank's sign and coronary artery disease. Patients with coronary artery disease are more likely to exhibit earlobe creases compared to those without the disease. Frank's sign has garnered attention as a potential diagnostic marker for coronary artery disease. When evaluating patients with suspected coronary artery disease, the presence of earlobe creases can be considered alongside other risk factors. Incorporating Frank's sign into coronary artery disease risk assessment algorithms may help improve early detection and preventive strategies. 3. Frank's sign and neurological disorders. Investigating the connection to dementia.
Really bothersome. Now, I'm not going to stereotype a whole culture, but
beyond cardiovascular health, Frank's sign has also been associated with neurodegenerative disorders, particularly dementia. Studies have shown a higher prevalence of earlobe creases in patients with dementia compared to healthy individuals. Other neurological conditions. In addition to dementia, Frank's sign has been linked to other neurological conditions such as cerebrovascular diseases, including stroke. Research suggests that the presence of earlobe creases may be indicative of increased risk for certain cerebrovascular events. 4. Other potential associations. Cardiovascular and metabolic disorders. Apart from coronary artery disease, Frank's sign has been associated with other cardiovascular and metabolic disorders. Studies have reported an increased prevalence of earlobe creases in individuals with hypertension and diabetes. These associations may be attributed to shared risk factors and underlying vascular abnormalities. 5. The importance of detailed self-observation. Understanding your body's clues. The discovery of associations between Frank's sign and different health conditions highlights the significance of self-observation. Paying attention to subtle physical features, such as earlobe creases, can serve as an early warning sign and prompt further evaluation. Conclusion. Frank's sign, characterized by diagonal earlobe creases, has emerged as a potential clue to underlying health conditions, particularly coronary artery disease and dementia. While the exact mechanisms and clinical significance of this sign are still being investigated, its observation can serve as an additional piece of information for early detection and intervention.
Well, there you have it, folks. I guess if you have droopy earlobes and baggy eyes and orange hair and narrow shoulders, narrow back, frail, I guess we have to look a little bit deeper into some of these things, and it could be more than just droopy eyes, droopy earlobes, narrow back, frail. It could be much more. These things could be indicators of serious health problems, like saying inappropriate things to children, or heart disease, hypertension, diabetes, stroke, dementia, Alzheimer's. So make sure that you get yourself checked out if you notice Frank's sign, folks. And once again, folks, thanks for tuning in to the one, the only, the true, the original My Philippines Interest. I'm here because you're there. Everyone, take care.